Good evening. I want to thank everyone for joining me today. My name is Fred Adams. I'm one of the vice presidents and founding partners of Medigap Advisors, and I'm here tonight to discuss with everybody 7 different ways that Obamacare, or the Affordable Health Care Act, or health care reform, however you would like to refer to it, is going to be affecting your Medicare benefits. Now, if you're like me, you probably heard a lot of talk that nothing related to health care reform was actually going to impact senior citizens. Unfortunately, that's not exactly proving to be true. Now, I do want to let everybody know right this second I have all the phone lines muted so we don't hear any background noise or interference from somebody that may be on a cell phone or in a crowded area. It'll take me 20 to 30 minutes to quickly go through these 7 ways Obamacare will affect your Medicare. Once I get done, I'll unmute the phone lines and take as many questions as we have. And if you happen to be watching the presentation online, you should see a little chat box, and please feel free to leave questions at any point during my presentation. And as soon as I get done, I'll reply to any questions that we had there before unmuting the phone lines. So let's go ahead and get started and look at 7 different ways that the health care reform law is in fact going to be impacting Medicare both today and for years to come. One of the first things we know is, despite any rhetoric that we may have heard to the contrary, Medicare is facing dramatic funding cuts as a result of this law. The law is projecting $457 billion to be removed from Medicare funding between now and the year 2020. And 50% of the funding cuts are supposed to be coming from Medicare provider reimbursements. So what that means is the doctors, the hospitals that you see today, Medicare is indicating they will be reducing the amount that they will reimburse your providers for your health care services in years to come. And that's something I'll talk about a little bit more later on. I've actually had several conversations with physicians over the last few weeks, and I can assure everyone right now the thought of that actually coming to fruition has quite a few doctors in this country considering closing their doors and no longer practicing medicine. Now, to me, one of the most stunning facts that I've learned as I continue to immerse myself in this law and learn how it's affecting both my health insurance and my Medicare clients is approximately 30% of the cost of implementing health care reform and offering subsidized health insurance to people under the age 65 that are not on Medicare is supposed to come from funds that, prior to the passage of this law, were intended for those individuals that are over the age of 65 and a part of the Medicare system. So whether we're going to feel a pain in the future because of cuts to Medicare, because our doctors or hospitals may no longer accept Medicare, or because our benefits are going to be reduced to help pay for health insurance for people under 65, there is no doubt whatsoever that this law, by the pure words that were written on the paper that enacted the legislation, will definitely have a dramatic effect on Medicare for many years to come. Now, I mentioned fewer providers just a moment ago. Right this moment, it's said that approximately 96% of doctors in this country accept Medicare. That doesn't mean 90% of the doctors will accept new Medicare patients, because only 4 out of every 5 doctors, or 80% in this country, will accept anybody that's just joining the Medicare system that's not already a patient before aging into Medicare. And if you happen to live in the great state of Texas, at this point in time, only 60% of the doctors in your state are accepting any new Medicare patients. And you consider the fact that we have 10,000 individuals approximately that are joining the Medicare system each and every day. and fewer doctors that are accepting Medicare, then there's obviously going to be a problem sooner or later down the road, because fewer doctors and more patients are going to result in much longer waiting times, both before you can get an appointment to see your doctor, and then once it's the day that your appointment finally arrives, you're probably going to be waiting longer in the office to see your doctor than you ever have before. And it was actually reported just last year that 28% of people that joined Medicare for the first time last year that did not already have a relationship established with a doctor had a hard time finding a new primary care physician that would actually accept Medicare as their health insurance coverage. And if you've paid much attention to our great country's budget crisis over the last decade, especially if you've been watching any proposed cuts to the Medicare system itself, you probably are well aware that 10 years ago, the budget indicated that Medicare doctors and hospitals were going to be paid 3% less for their services in 2014. Well, at the very last minute, Congress took that line item out of the budget and figured they would make up for it in the future. So the following year, there was scheduled to be a 6% reduction in what your doctors were paid for seeing a Medicare patient. That was taken out of the budget again. By the time we got to this year's budget that was being passed about a year ago, it called for your physicians to be paid 27% less than they were paid for their services during last year. And once again, at the 11th hour, Congress somehow found a way to strike that line item out of the budget. And since the Medicare system is operating at such a deficit as is, all signs are indicating that when this year's budget or the budget for next year is finally approved as we head into 2014, your doctors are going to probably be looking at a 30% reduction in what they're paid for treating Medicare patients. And as a result, more and more doctors are just choosing to opt out of accepting Medicare at all. And one of the biggest, most striking examples that I've heard this year is the Mayo Clinic, which is regarded as one of the best hospitals in this country, with many of the best physicians that we have, the brightest minds available to treat people in need of medical care. Well, if you happen to be on Medicare and you opt to get treated at the Mayo Clinic, at this particular point in time, they're no longer accepting that as your health insurance, and they expect you to pay for the entire cost of your treatment. So that's just Medicare in general. I want to talk for just a minute about Medicare Advantage, which Medicare Advantage is a type of Medicare product where you're receiving all of your medical benefits from a private insurance company, as opposed to the federal government paying 80% or so of your medical bills. Well, if you have a Medicare Advantage plan, that program is looking at big funding cuts in coming years as well. Next year, the U.S. government is offering $7 billion less than they did this year to private insurance companies that offer Medicare Advantage products. And as a result, since the federal government is reimbursing these companies so much less for every person that's insured by a Medicare Advantage product, that means that if you have Medicare Advantage, you're going to see one of two, if not both, of these things occur. You're either going to see an increase in your monthly cost, so your premium's going to be going up, or your insurance company is going to provide you with fewer benefits next year than they have this year. And that's just with $7 billion being cut out of the budget for Medicare Advantage next year. 5 years from now, the total funding cut for the Advantage system is going to add up to $135 billion. And I do not say that to discourage anyone from not considering a Medicare Advantage policy. It just happens to be the annual open enrollment period for Medicare beneficiaries to switch to a Medicare Advantage. And if you're in a position where you either can't afford a Medigap or Medicare supplement plan, or if you just don't want to pay a monthly premium, I can say that you're probably better off having a Medicare Advantage product than you would be staying with original Medicare. And the primary reason I say that is any Medicare Advantage product must cover at least as much as Medicare would cover, but they also have to put a limit on your out-of-pocket spending for medical bills over the course of the year. So if you had original Medicare and you're paying your portion of a hospital stay and 20% of your doctor bills, the amount that you pay for your medical care next year can literally be unlimited. If you have a Medicare Advantage product, the worst case scenario for you would be spending $6,700 for covered medical expenses. And after that point, the private insurance company offering your Medicare benefits would pick up 100% of the cost of your covered medical expenses from there. But as insurance companies are being paid less by the federal government for covering people in the Medicare system, we've seen a lot of companies leave the Medicare Advantage market, so there's fewer choices of you to choose from Advantage plans. Most Advantage policies are either reducing their benefits or they're charging higher premiums. It's been very common for the last 6 or 7 years for our clients to have the option of several different Advantage policies that literally had a monthly premium of $0. There's not as many of those $0 premiums available as there used to be. You can still find at least one in most geographic areas, but a couple of years ago, you could find at least 3 or 4 in most areas. And by the time we get to 2019, and this $135 billion has been yanked out of the Medicare Advantage funding system, it's estimated that the average senior will be paying between $50 and $90 more each and every month, either more in insurance premium or more in their out-of-pocket expenses that they pay when they actually go to see a doctor. Now, whether you have a Medicare Advantage product or you have original Medicare, or if you just happen to be somebody that's listening to tonight's presentation to learn about how Obamacare is actually affecting Medicare now that this law is upon us, everybody in this country is going to be faced with many, many new tax burdens that we've never faced before. With the federal government offering to subsidize the cost of health insurance for millions and millions of Americans, those subsidies the federal government's going to be paying to an insurance company. And that money has to come from somewhere. It could come off the printing press, I guess, at the Treasury office, but a more realistic way for the government to try to recoup all this money they're spending is tax increases. And some of the tax increases that directly affect people that have Medicare is if you're a high earner, which means $200,000 a year as an individual, or $250,000 if you're filing a joint tax return, your Medicare taxes are going to be going up by 3.8%. Anybody that has any investment income, the taxes on those interests that you earn will be going up 3.8%. Any insurance company that's offering a medical device, it's commonly referred to as durable medical equipment. This could be anything from a wheelchair to crutches to an oxygen tank, and many, many different items are considered to be a medical device. Well, all new medical devices now are charged an additional 2.3% tax. And some people may be of the mentality that that 2.3% tax is going to be paid by the company that's providing your medical equipment, and in a way it is. But ultimately, all that's going to do is drive up the cost of medical devices for each and every consumer that needs to utilize such a service. And the same thing goes for the last tax that I have mentioned here on this particular slide. insurance companies are looking at facing $72 billion in new taxes as a result of Obamacare in the coming years. And just like any other business, an insurance company has to look at the cost of doing business, and suddenly they're going to incur $72 billion more in taxes, which means that the cost of anybody receiving insurance benefits will be going up, because the more it costs to do business, the more you have to charge to the end user of whatever product it may be that you happen to offer. Now, here is one thing about Obamacare that is a good change, at least for some people. And on the surface, this particular piece of the legislation looks a lot better than it really is if you actually look at what it means in the end. And I'll explain myself in just a moment. But if you've had a Medicare Part D policy in the past, which D stands for drugs, it's also known as a Part D prescription drug plan, then you've probably heard about this crazy thing called the donut hole. And I'm not going to go into explaining the donut hole this evening. It's always been a pretty convoluted formula, if anybody wants my personal opinion. And I love the fact that a few years from now, when I talk to clients about prescription drug coverage, I won't have to explain the donut hole and how it works, because it's one thing to understand it yourself, but to explain it to a lot of people in terms that they can understand, it's not quite as easy and simple as it should be. But the way that Obamacare is currently improving your prescription drug coverage if you're a Medicare beneficiary that has a Part D plan is when you do fall into the donut hole, this year you're getting a discount of 52.5% for any brand name drugs that you take. So just to use an example, if you're going to the pharmacy and you're picking up a brand name drug that would normally cost $100, you're going to get a discount of 52.5%, which means you'd pay $47.50. If you happen to wonder who's going to cover that other $52.50, it's actually not the federal government. It's the provider of the pharmaceutical medication that you're taking. They, as a result of this law, if anybody is in the donut hole, they just have to kind of eat that 52.5% and not be able to get their full allowable price. And that sounds like a great thing, especially anybody that's ever fallen into the donut hole and had to be paying the majority of the cost of their prescriptions. And if you're taking generic drugs when you're in the donut hole, which if all of the medications you take are generics, you're probably not ever getting to the donut hole anyway. But if you do, you'll be getting a discount of 21% on the cost of your generic drugs. So why do I say that on face value this looks like a great thing, but in reality it's maybe not quite so great? It's the simple fact that each year only 3.4 million Americans ever reach the donut hole. So anybody else that has Part D prescription drug coverage, which is an estimated 27.5 million Americans, they don't ever reach the donut hole. So those couple of benefits that I just mentioned are of no benefit whatsoever to them, because they don't ever spend enough on drugs to get to the donut hole. Well, by the time we get to 2020 and the donut hole is totally gone, the way that prescription drug coverage is going to work from there is each and every consumer in this country that has a Part D prescription drug plan, you're going to go to your pharmacy and you're going to pay 25% of the cost of that medication that you need, whether it's a generic or a brand name drug. And ultimately, what that's going to result in for the 90% of people that never fell into the donut hole, that have presently been paying maybe 5 to 10% of the cost of their medication, they're going to see the cost for their meds increase, while approximately 10% of Americans that have been falling into the donut hole, they may see their drug costs decrease, And that's really going to depend on what medications you're taking. And if you look at the retail cost of that drug, is 25% of that more or less than you've been spending today when you fall into the donut hole? And that's kind of an unknown. I have no doubt that 7 years from now, the cost of prescription drugs are going to look different than they do today. I can say that simply based on the fact that many brand name drugs today will be generic by that year, and who knows how many different drugs we'll be taking that haven't even been invented yet. And anytime a medication is new and it's still a brand name, the price tends to be astronomically more than it is to take any generic drug. So all in all, the donut hole closing, it's a good thing for some people. But I believe by the time 2020 gets here and that hole's closed, we're going to see more people that are not happy with their prescription drug coverage than we do people that are benefiting from this piece of the legislation. Now, what about free preventative care? There is no arguing this is a great thing for everybody in this country. If we take advantage of the free preventative care that our health insurance has today, and I say that whether you have Medicare or if you're somebody that's under 65 and you still have a regular health insurance policy, all health insurance in this country now has to cover the recommended preventative care services as recommended by the U.S. Preventative Care Task Force and shown on Schedule A or Schedule B. And we see a list here on my screen of most of the free preventative care services. A lot of these are things that people are already having done on a regular basis anyway, whether it's checking your blood pressure, watching your cholesterol. And if you're a man and you're over the age of 50 and it's time for you to have that colorectal exam, I know the retail value of that particular examination tends to average about $3,500 nationwide. Well, if you're having that colonoscopy when it's considered to be age appropriate, according to the U.S. Preventative Care Task Force, now you're not going to pay a single penny. And I do encourage everybody to take advantage of all of these preventative care services because there's no doubt at all that the sooner we detect any potentially long-term, devastating, or terminal disease, the easier it is to address, to hopefully heal and recoup from. And if we can all do that and detect our problems earlier on in life, then eventually the cost of health care actually could go down. But if you're not taking advantage of the free preventative care services that are available to you, then you're probably not going to be detecting any potentially dreaded disease early. So please take advantage of the age-appropriate free preventative care. It's one of the best parts of this law. And the other slide that I'm showing here, it's just a series of free preventative care immunizations or vaccinations that are available to all. Probably the most common one that I hear about at this time of year as we're getting closer to the winter season is the annual flu shot. If you have a health insurance policy or Medicare, you can get your annual flu shot at no cost at all to you. And I personally don't like to get a flu shot, but I know a lot of people that it helps. I had one once and found myself sicker that year than I ever was any other year, so I've opted out of the flu shots. But a lot of friends, family members, and clients indicate they have them and don't ever get the flu. So if you want to make sure that you can potentially avoid that this year, you might want to take advantage of your free flu vaccination as well. Now, a couple other ways that some of the legislation that's become known as Obamacare can or will potentially affect Medicare beneficiaries is the law created a couple of different things. One that's known as an accountable care organization, a second that's known as an independent advisory board. And an accountable care organization is not all doctors and hospitals are choosing to participate in these particular organizations, but if they do, the ACO, we'll call it for short, They're trying to help lower the cost of medical care for Medicare beneficiaries. And if they can show CMS or the Center for Medicare Services that the cost of treating their patients is less than the average Medicare beneficiary, then any of the cost savings, the Medicare system will keep half the savings, and they will pay the accountable care organization 50% of the additional savings. So of all the physicians I've spoken with recently, some have been getting on board and joining these ACOs. Others weren't, because they indicated to me that the accountable care organizations were trying to help the Center for Medicare Services in lowering the physician reimbursement rate, and those particular doctors didn't want to have anything to do with that. They were willing to give up a potential 50% of the money that they may save Medicare in order to try to keep their day-to-day reimbursement rate where it is today and not going backwards. Now, the Independent Advisory Board, I'm going to touch on just a little bit more. This is one that, while the mass media may have misinterpreted what these advisory boards was intended to do, if you think back to when we had all the political battles being fought as they were talking about passing the Affordable Care Law, we used to hear a lot from the Republican side of things about the death panels that were going to be created if this legislation was passed. And if you think back to the first time you ever heard that term used, was actually credited to Sarah Palin as being the first person that referred to the death panels. And I'm not here to make any political commentary one way or the other. I'm just kind of shedding light on these advisory boards or exactly what Ms. Palin was talking about back in 2009 before this law was passed. And I think calling it a death panel was exaggerating the situation dramatically. But what these advisory boards are put in charge of is reducing the amount of Medicare spending. So the Center for Medicare Services each year, they project for every Medicare beneficiary what's the average amount of money that we're going to spend to cover our portion of your medical bills. And if Medicare spending goes over that number, then the Independent Advisory Board, which is a panel of just 15 individuals, convenes and they try to figure out how to lower the cost of medical care for Medicare beneficiaries. And any changes that that board recommends automatically becomes a bill that is sent to Congress and to the President to turn into law. And if Congress chooses not to pass that bill as written onto the President to sign, then it's up to Congress to come up with some mathematical formula that will reduce the Medicare budget by the exact equal amount that this advisory board suggested. And I've actually seen a couple of real-life examples of how some of the changes recommended by these advisory boards are starting to affect real-life Medicare beneficiaries. And the primary one that comes to mind is a client that I spoke with 3 or 4 weeks ago. She had to get a regular vitamin B12 injection once a month. Medicare had been paying for it for 10 years. And when she went into the doctor the month of her 76th birthday, the physician's assistant, before the injection was administered, came and told this nice, kind lady that Medicare was no longer going to be paying for that service because she was now over the age of 75. And to be perfectly honest, after speaking with this client, I went and tried to dig through every piece of printed material I could that referenced that the Center for Medicare Services had actually enacted that exact piece of regulation that said it wasn't worth it to them to keep paying for somebody's B12 injections once they were over the age of 75. I was unsuccessful in that research, But I heard the same thing just a couple of days ago, and this time it wasn't a client. It was one of my very best friend's fathers. So I have no doubt that there is some amount of rationing of medical services that are starting to happen to Medicare beneficiaries that did not occur prior to the passage of this law. I've seen it once with a client and experienced it once with a best friend, and there's no way those are the only two individuals out there that are seeing their medical services actually reduced as a result of this law to help pay for health care for younger individuals that haven't worked the majority of their adult life waiting to be able to join Medicare and get the benefits that you paid into for so many decades. So what are a few things that won't change? Or maybe I should say that haven't changed yet, because we don't know what the future is going to hold in store. I'm pretty sure there has to be a reduction in funding for Medicare. Not only does the Affordable Health Care Act say there has to be, but the sheer economics of the number of people in Medicare and the current budget that they have, the math doesn't work. But as of today, there's a few things that have not yet formally changed. One is your cost sharing. So that's any deductibles or co-payments or co-insurance that you have to pay when utilizing your Medicare benefits. Now, I should probably be careful saying the deductible won't change, because most years the deductible, if you go into the hospital, it goes up $10 or $20 every year. But there was nothing in this legislation that said that Medicare cost sharing had to be increased. I've seen a lot of talk that one of the ways that they're trying to fix funding for Medicare is, instead of covering 80% of most of your medical bills, maybe Medicare is going to try to cover 70 to 75%, which ultimately means you have to pay more unless you have some kind of supplemental coverage. But that's not part of the legislation that we're here to speak about this evening. There were also no changes to the benefit period. There had been talk of a benefit period being reduced so that you had a new deductible anytime you had not had care for 30 days instead of 60 days as it stands today, but that was not enacted. Doctors are still allowed to charge excess charges if they choose not to accept the Medicare assignment as payment in full for their services. And you still have the right to choose any doctor as long as your doctor continues to accept Medicare. And probably the best news out of anything that is not changing yet is for anybody that has a Medicare supplement policy, Plan F's the only supplement that covers all the gaps in Medicare. So anything Medicare covers part of, if you have a Medigap Plan F, it would pay all of the rest that Medicare doesn't pay. And there was a lot of talk of trying to make it illegal for insurance companies to even offer such a product, because there's a theory out there that if the consumer doesn't have to pay anything for their medical care, that you're more likely to overutilize services that you may not need or you wouldn't otherwise seek if you had to pay part of the bill yourself. So there was a lot of people in Congress pushing to take the Plan F away, and thank goodness that has been overtaken, at least for now. Plan F does remain an option available to anybody interested in having the most comprehensive health insurance coverage possible. So what are a few tips that I can leave you with that you can do now to start protecting yourself from any changes that may occur in the future? And we're getting pretty close to the end, and I'll start taking questions in just a moment. The first thing I suggest to you all is establish a relationship with a primary care doctor now. You may want to find a doctor that accepts Medicare assignment as payment in full. If not, then you definitely want to look at purchasing a Medigap Plan F while it's still on the market. If you have a Plan F and the law ever changes and says that policy can no longer be sold, you're probably going to be allowed to keep it. And I hate using the word probably there, but when I'm talking about the Affordable Care Act, and we all heard so many times, if you like your coverage, you can keep it, I'm not going to make that blanket statement because we don't know what the future holds in store. And if you happen to be somebody that still has regular health insurance or know somebody that does, you've probably heard some stories about millions of Americans that thought they could keep their health coverage that have been receiving cancellation notices recently indicating their policy was going to go away. But based on what I've seen in the past when Medicare supplement laws and coverages have changed, if you have an existing policy, you're normally allowed to keep it. So if you're going to consider getting a Plan F, you may want to think about doing so sooner rather than later because we never know when that policy will be taken off the market. And getting back to the first checkpoint here about establishing a relationship with a primary care doctor now, the main reason I like to emphasize that is most doctors, if you already have a relationship and they are treating you and they opt to no longer accept Medicare, they'll continue seeing the patients that they have today, even if you are on Medicare. They just won't take any new Medicare patients moving forward. So you want to make sure that you have a good relationship with a doctor you're comfortable with and you trust while they're still accepting new Medicare patients, because when next year's budget gets passed, if the 30% physician reimbursement reduction is really there like it's supposed to be, a whole lot of doctors in this country are no longer going to take Medicare, and some have told me as recently as the last week that they would literally close their doors and stop practicing medicine altogether. Others have said they would just treat cash patients and not accept any insurance, but whichever way you look at it, if you have an established relationship with a doctor, you're going to have a better chance of keeping him whatever changes the future may hold in store. And definitely utilize the free preventative care services that are available that we discussed earlier. And, of course, the best way to help care for your health and avoid any medical concerns in the future is through proper diet and exercise. And I know nobody came here tonight to hear that from me, but we're talking about taking care of our health, and taking care of yourself starts at home within yourself. And making sure you put the right foods in your body and that you have a little exercise from time to time are two great first steps to avoiding needing medical care or having to worry about what Medicare may pay for if you go to the doctor, because if you stay healthy, you don't need to go to the doctor quite as often, especially if you take advantage of those free preventative care services. That way, if you were to be developing some sort of dreaded disease or potentially harmful condition, detect it early, minimize the number of times you have to see the doctor so you can spend more of your time in your life doing the things that you want, love, and need to do. So with all that out of the way, I've come to the end of my 7 ways that the Affordable Health Care Act, or good old Obamacare, is already starting to affect Medicare beneficiaries. I don't see that I had any questions come in via chat, so I'm going to go ahead and unmute the phone lines. If you do happen to have any questions, I just ask a couple things. Please state your first name so I know who I'm speaking with. I'd love to know where you're calling from today, and let me know what questions you have that I can be of assistance with.
Hello?
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 I hear lots of echo, but I definitely hear you there, sir. Any questions I can answer for you today?
Hell no, you old son of a bitch.
Excuse me?
He hurt you,
Excuse me, sir? Okay, I guess there's not a legitimate question there. Do we have any other callers on the line that may have any questions, or whoever that was? If I missed what you were trying to say, please feel free to try to restate yourself, and maybe the echo in your room prevented me from being able to properly hear you. Okay, well, it looks like we don't have anybody with any questions this evening. If any questions do arise in the future, whether it may be today or at any juncture moving forward, please feel free to reach out. We would love to be of assistance in any way we can. There's absolutely no charge whatsoever for any of our services. We're here to help as many of our fellow Americans as we possibly can get the best possible health coverage for their individual situation. So please feel free to give us a call anytime at 866-323-1441. Again, that's 866-323-1441. And before I say goodnight, one last chance for any questions? Well, if not, I hope everybody's coming away with a couple useful pieces of information you were not previously aware of. And if you do have any needs in the future, you'll reach out and let us know how we can be of assistance. We love to help people, and we'd love to help you too. So I hope everybody has a great night, and we look forward to hearing from you soon.
He hurt you.